We're gonna go over perineal stretching. So when we talk about the perineum, that is your space between the vagina and anus. This is your perineum here. When we talk about childbirth, we really wanna make sure that the perineum is stretchy and pliable, and this will help reduce your risk of tearing. There's no data to show that doing perineal stretching prior to birth is actually going to reduce your risk of tearing. However, it will at least mentally help prepare you for the sensation of an uncomfortable stretch, and you will learn how to breathe and relax through that prior to birth so that when you do feel that sensation during birth, it won't be quite as shocking and uncomfortable for you. So I at least recommend you to try this ahead of time. So when you're doing perineal stretching, I want you to think about the vagina like a clock. So 12 o'clock is up at the top, 6 o'clock's down at the bottom, 3 o'clock and 9 o'clock. So if you're looking at stretching, you're gonna wanna put one finger in, clean hands, use your favorite lube, and you're gonna wanna put one finger in and you're gonna wanna pull down about to the first knuckle and pull down and hold a stretch that's borderline uncomfortable, but we're able to breathe through it. And you're gonna hold for a few nice, deep, relaxing breaths. So you're gonna practice working on inhaling down from your belly, relaxing through your diaphragm, and you're gonna hold that stretch. So we're gonna do that 6 o'clock, 5, 4, 3, taking those, not that quickly, much slower, right? So we're gonna slow at 5, take a couple breaths, same thing at 4 and at 3 o'clock, and same thing at 7, 8, and 9. Now, in how to get into this position, we can either kind of use a thumb and squat. You can kind of lay on your side and pull from behind. You can have your partner, if you're laying on your back, you can have your partner put both fingers in and pull down and out like a J. So it's kind of swooping like a J. Or you can stand and do this in the shower, kind of like a Captain Morgan stance. So you'll be here and pulling backwards to the side, and then you'll switch sides, pull backwards into this side. So you've got options. Let's find what works the best for you and what's most comfortable position-wise for you to practice with. And that is how you're gonna do perineal stretching. So one knuckle in, to recap, one knuckle in, and then let's do a second round at 2 knuckles in. So we're getting a little bit deeper into the vaginal canal to stretch the vaginal tissue as well. Now, if this is painful for you, you're probably gonna need to see a pelvic floor physical therapist. So this should be uncomfortably tolerable for you. It should feel kind of like a little bit of a burning sensation, a stretching sensation, just like if you stretched your face, lips, without chapstick on. It might feel a little uncomfortable, but it shouldn't be painful. Please support us by liking and following for more.